room where he's coming back on. Dr. Vince Akimoto. We don't have any video because he's having a bad hair day. Is that what it is? What's the prescription for a bad hair life? Doc, are you there?
Yeah, you know, it's tough for an old guy like me to keep up with beautiful people like you and especially Sabrina. So it's not going to happen.
You're doing fine.
Oh
You're doing fine. Doc, we got a few minutes before we bring on public health, and I saw from your text that you wanted to come on and talk about the economic impact of this lockdown, correct?
Well, and I think the Chamber of Commerce is, obviously has something to say about it. They're apparently meeting this morning. There's apparently people that have decided over the weekend that they want to fulfill their right to protest this particular lockdown, and especially in light of the fact that there have been claims by people like me that this lockdown was absolutely the fault of the government of Guam's failure to be ready for this surge, which when we look at it, when statisticians like Dr. Lombard from outside using dirty data from JIC and the very limited information that the government has been releasing to the public, this looks like a catastrophic failure of our political system rather than a virus that has decided to become more malignant. This was anticipated. There was nothing about this that Guam shouldn't have been able to handle. According to the CDC letter written by the governor of Guam, we had more than enough contact tracers and more than enough ICU beds to withstand a surge 10 times larger than this. So we should have been able to open to tourism. Our economy should not have been devastated, and people should have been able to go to the beach this morning. So the transformation, the revelation is an opportunity finally for redemption. Because if this is what the government is producing, as much as they want to magically make everything happen for everybody, you cannot have a corrupted political system, a pari system, a spoil system that rewards people for not working and still be able to safely run public health, give Annette Santos and Dr. Kaneshiro the resources that they need to do their heroic work. Don't give them a bunch of lazy, bad attitude recruits from your political bandwagon to become the new contact tracers and then brag that we have 58. Even Hawaii had this problem. Their contact tracers are idiots. So Hawaii's overwhelmed, Guam is overwhelmed. But our problem can be solved very quickly. We hope within the next 4 weeks, if Ms. Annette Uggan and her team are given a chance to shine. She has some wonderful people, probably about 8 of them, who could teach people how to become wonderful contact tracers, and they can do their job. And then maybe we can reopen our economy safely so that our hospital, this is the critical issue, doesn't become overwhelmed. And so the chamber can rant all they want about how much money they are losing, how much money Guam is losing, how much domestic violence there is, how many suicides are being done, and what cost that is to the community. But in the end, this is the come to Jesus moment. You cannot honor God and honor money. And we will say that Guam is trying to give money to their friends at the cost of our people and the goodness of God. They declared God non-essential yesterday. So this is probably why Father Gofigan is irritated. But what we need to say this morning before we bring public health on is don't get mad at them. They're the ones that show up early. They're the ones who come out of their comfort zone to tell you what's going on. Don't get mad at the emergency room doctors and nurses who are there, and maybe they're grouchy, but they've been working probably 72 hours straight. Get mad at your senators. They haven't done a damn thing. All week, they have done nothing. And now they're going to go into emergency session. So maybe we're going to get help for public health. Maybe we're going to get help for GMH. No, they're going to go into their third emergency session regarding their election, their political status, their job. I think the people of Guam are tired of this. I hope they are, because you're in lockdown. So unless you enjoy this, you might want to change what we're doing. And one of the first things to do is change our senators. That's all I needed to say, because I know the Chamber of Commerce is going into a special meeting this morning. And so a statement should be forthcoming. A lot of folks are not happy with this lockdown. And I think rather than complain, we should focus positive energy and effort to toward fixing the problem. And best we can tell, in every other place where this is working, in Singapore, Taiwan, South Korea, Germany, it's contact tracing and a strong hospital system, especially a critical care unit where we have enough nurses and respiratory therapists. And we need to pay them if that's what it takes to get the 48 nurses out of DOE motivated to actually train themselves to be useful as hospital nurses. We need to train them and pay them. But that's a human resource thing. We have, Lord knows, way too many people in personnel and HR throughout the government. Maybe they can get off their fat asses and do something useful today, because we keep saying we don't have enough nurses and doctors and respiratory therapists, but we sure have a lot of personnel specialists. I hope I offended somebody just now, because again, we are in a state of emergency. There's nothing comfortable about this. You're not supposed to be happy. You're not supposed to feel cuddly this morning. You're supposed to be pissed off.
Right.
And,
Doc, I'm not saying that I disagree with you, and I'm not saying that I agree with you, but just playing devil's advocate here, what would you say to those who may say, Doc, we need to unite. Now's not the time to be criticizing. Now's not the time to be talking crap. What would be your response?
We did that after the first lockdown. Everybody did kumbaya, and we're not talking about just talking crap. Because if you make this big of a mistake, if you went 5 months where we had to listen to what you had to say and you did it wrong, you hired 110 people into the hospital that had nothing to do with saving our ass. If you went out and hired 50 contact tracers that don't want to work for a net, or if they do, it's either a net's fault or it's their fault. I'm going to put the blame on the flunkies that they put in there that had no clue how important their job was. But you can let Annette speak for herself. Either way, the failure to track the Chucky's funeral is the reason we're in this lockdown. The spectacular failure of contact tracing on every level is why we're here. So Annette's got a tough job. That's my way of routing up the crowd so that she could have everybody paying attention. No, it's not time to believe magically like unicorns that this is going to get better if we don't all step up. And it's going to be noisy. Deal with it.
Doc, since we do have you on the phone, I wanted to ask, have you heard anything about what's happening over at the hospital over the weekend? I was hearing that there may have been a situation where they may not have had enough bed capacity to take in COVID patients. Have you heard anything about that?
I saw it on KOM News. I heard it in the desperateness in both the governor, who's a former ICU nurse, and Lilian Posadas, who is also an ICU nurse and the hospital administrator. The GMH is being overwhelmed. This is not a secret. I don't think they're trying to hide it, but when you run a code on a patient, when somebody's dying and we're trying to give life support, we close the curtains. You don't want to see what they're doing up there, and you can't help them. The help that they needed was to keep people from going there, and we failed, and public health failed spectacularly. Let's not make this nice. We need to do better, and I think the National Guard, with its leadership and its inherent infrastructure administratively, can help accelerate a lot of the fixings, the solutions at public health. The people up there know what to do on a granular level, but from a leadership standpoint, an integration standpoint, and from a speed standpoint, an efficiency standpoint, they're the worst. They've always been the worst, and they can't deny it. Everything takes too long with public health, and right now we are in a public health state of emergency. I'm calling on the governor, if she's listening, to let Dr. Mike Cruz be the COVID-19 czar. He's the Surgeon General for the National Guard. He has people throughout the government, throughout that system, that can go into public health and the hospital and help accelerate the solutions that we know we need to apply. This desperate plea to FEMA and to the Navy to send us nurses and respiratory therapists, that's like we're already in the cold water and the Titanic has already sank. I don't think we're there yet, but maybe you can interview the people in the hospital. I'm hoping that we can still bring our own people to this fight, to this solution. We have nurse anesthetists in all the surgery centers on the island. There's probably about 10 of them. We have 48 DOE nurses, some of whom used to work in the hospital. Some of them used to be our best nurses in the hospital. but they've gotten too used to being lazy and working in the schools of Guam, not doing much. So today they need to do something.
All right, Doc.
Yeah, this is time for harsh, honest, brutal talk. We need to get going. There's a fight going on and we're losing.
All right. I don't
Thank
think
you
you know
so
how to
much.
give it any other way, Doc. I wouldn't. You know what?
Sorry,
I
my
like it.
hair's giving me a hard time.
That's
but
okay, all right,
that's all I wanted to say, because it's not over. This is not theater. This is not shock. And,
Right.
we're not Howard Stern, man. I'd like to go back to my quiet country doctor life.
All right, Doc. Thank
Thanks,
you.
Doc.
Dr. Vince Akimoto. We're going to take a short break, 7:20, and we're coming back with the very public health people that he was just talking about. We have Annette Uggan